What do you mean by Dosha Svabhava and Dushta Dosha Avastha? This is the topic of this particular video. Dear ANA community, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you discuss about the Dushta Dosha Avastha and Dosha Svabhava, this is available in the Charaka Samhita textbook. When you think about the Charaka Sutrasthana 15th chapter, that says Sukshmanihi Dosha Bheshaja Desha Kala Bara Sharira Ahara Satmya Sattva Prakriti Vayasam Avasthantarani. So that has to be Avasthantara of these different aspects. That is categorized under, what do you say, that the whenever if you are going to analyze the patient as such. So here Dushta Dosha Avastha, so that is referring to Avasthantara of the dosha. Doshasya Avasthantarani. So that is being mentioned by the Chakrapani commentary. Kshayaha tatha vruddhihi tatha samatvam एवं ऊर्ध्वगमनम ऊर्ध्वदेहगमनम तथा अधोदेहगमनम तिर्यगमनम वा तथा शाखाश्रयित्वम कोष्ठाश्रयित्वम मध्यमार्गाश्रयित्वम तथा स्वदेशगमनम परदेशगमनम तथा स्वतंत्रत्वम परतंत्रत्वम च ततः अंशांश विकल्पः तथा धातु विशेषाश्रयित्वम तथा काल प्रकृति दूष्य अनुगुण अनुगुणत्वादि कृष्ण tantra pratipaditāni jnayāni. So whenever we are analyzing the Dushta Dosha Avastha, so we are going to note about the state of the dosha present in the body. Whether is it in the Kshina Avastha, Vruddha Avastha or Samya Avastha, or whether is it in the Urdhva Gati or Adhogati or Tiryak Gati, or whether is it in the Shakha Shayat or Koshtha or Madhyama Marga, or whether is it Swatantra or Paratantra, or whether is it Swadesha Gamana or Paradesha Gamana, or whether it has to be analyzed by each and every point of what you say that guna increase in the body. So further, which particular dhatu is being afflicted, and we need to know about the dushta dosha in terms of kala, prakriti, and dushya, etc. That has to be analyzed whenever we are going to look into the dushta dosha avastha concept. Whereas dosha svabhava tesham sarvesham vatapitta sheshmanu dushta dushayitaro dosha svabhava. So that is the dosha svabhava is the one by nature itself they can able to vitiate the body if any kind of the slightest etiological factor is being exposed. But so here dosha svabhava, so that is the only related to the, what do you say, that the dhatu, etc., etc. Whereas there are certain situations that is being mentioned. So here that is Kesha, Mutra, Nakhadi, Ashrayatvam, Dushta Dosha Lakshanam, Yatrana Uttam. So that means the Dosha Swabhava. So that is the main aspect of Dosha Swabhava is to afflict the Dhatu, etc. They are not going to afflict Kesha, Loma, Nakha, etc. They are not going to get afflicted. This is the word meaning of this particular shloka as such. We are going to learn these with a few examples. For example, the person is coming to you with the history of a constipation. How we are going to analyze the Dushta Dosha Avastha? So based on the description which are being given earlier, so here first context, that is, it is categorized under Vata Vriddhi, or we may say that there may be a possibility of Kapha also, but as the person who is having increase of the dosha, they are responsible for the disease manifestation. So here we are going to consider that is the vriddhi of the vata dosha. So here, so second context, as it is being present in the lower abdomen and the person is having the clinical presentation of the lower part of the body, we are going to say that could be adhodeha gamanam. As the person is having the presenting complaint related to the, what do you say, that the mahasrotas, we are going to consider this may be the koshtashrayatva. And as the swadesha gamana, we are going to say it is considered to be due to the vata dosha prakopa, and the person is having the clinical presentation related to pakvashaya, we may say that it could be swadesha gamana. And as the dosha is responsible for the clinical manifestation is vata and the person is having the vata dominant feature, we may say it could be swatantratva. As far as amshamsha vikalpa is concerned, here vruksha and khara guna vriddhi we are going to observe. As far as the further aspect of the Dushta Dosha Avastha in terms of Dhatu Vishesha affliction. So here we are going to say there may be a possibility of a Purisha affliction. As far as Kala Anugunatva is concerned, so that is in relation to time period. Time period, it may be of minutest one till the whole, what do you say, that the time period of an lifespan of an individual we can able to consider. So here, as the Kala Anugunatva is concerned, it is present in the elderly individual, which is indicative of Vata dosha dominance. And if the person is presented with the early morning clinical feature, we are going to say there may be the Kala here, it could be early morning as such, again, which may be indicative of Vata dosha dominance. And if the person is having this particular clinical presentation in case of the summer season, we may say it could be Grishma Rutu. And when you think about the Prakriti Anugunatva, if you see the overall clinical feature, we may say there may be a possibility of a Vata Pitta Prakriti of an individual. In that particular situation, the person who is having the constipation and Vata Prakriti, Vata Pitta Prakriti individual, it may be of a Madhyama severity. As far as Dushya Anugunatva is concerned, that has to be differentiated based on the Dhatu afflicted. So here we may say there may be a possibility of a the Pitta Purisha affliction. When you analyze the example with another example of Dushta Dosha Avastha, so here the another patient presented with breathlessness. How to analyze the Dushta Dosha Avastha here? So here, based on the clinical presentation, we are going to say there may be a possibility of the vriddhi of either Vata or Kapha. If the person is presented with dry cough, we may say there may be a possibility of vriddhi of Vata. And if the person is presented with productive cough, then we may say there may be a possibility of Vruddha, Kapha and Vata. And as the clinical presentation is related to upper part of the body, we may say he is having the Urdhvadeha Gamana. And as far as the third context of Dushta Dosha Avastha, that may be indicative of Madhyama Marga involvement. And depending upon the dosha dominance, if it is having the Vata dosha dominance, then we may say it may be a possibility of a Paradesha Gamana. And if the person is having the Kapha dosha dominance, then we may say there may be a possibility of a Swadesha Gamana, as the site of the lesion is Uras. And further, depending upon the Swatantratva and Paratantratva, so that is Pradhanya of dosha, we may able to say that may be a possibility of a Swatantrata or Paratantrata. Based on the Amshamsha Kalpana, we may say there may be a possibility of a Shita Guna increase, which may indicate the vitiation of Vata as well as Kapha dosha. Further, regarding the uh, Dhatu affliction as such, we may suspect there may be a possibility of Rasadhatu affliction. Based on the Kala Anugunatva, we are going to say there may be a possibility of a increase of the, but you say that the elderly people, so here it is a middle-aged person, and in the early morning, the person is having this particular clinical presentation. and it is a Shishira Rutu, then we are going to say the Kala Anugunatva as such. So, whereas the Prakriti Anugunatva, so here if the person is having the Vata Pitta Prakriti, then which may be considered to be the further this will be helpful in deciding the treatment of an individual or management of the individual. So here Dushya Anugunatva Rasadhatu affliction we may suspect that. Whereas the Dosha Svabhava refers to the tendency to vitiate the dhatu based on the Nidana exposure. So that is the Shitaguna exposure. So that is the to the skin. We may suspect there may be a possibility of a rasa or rakta dhatu involvement as such. Whereas the Shita Guna exposure to the eye, we are going to say there may be a possibility of mamsa affliction. We may suspect that. So that means whenever there is any kind of the involvement of the dhatu, we may suspect the what do you say that the dosha involvement there, whereas the organs such as Kesha, Nakha, Mutra, etc., we are going to say there may be the possibility of a no dosha involvement there. Kesha, Mutra, Nakha, dosha yatha na uktam. So that means Kesha, Nakha, etc., that will not be having the involvement of the dosha. Dear ANA community, that is what the information that will be discussed here today. What are to sum up, Dushta Dosha Avastha, that is indicative of different stages of the dosha, abnormal dosha in the body, whether is it in the Kshina Vruddha Avastha or whether is it in the Urdhva or Adha or Tiryak Gati as such, or whether is it in the Shakha, Koshta or Marmasti Sandhi, or there is it in the Swadesha Gamana or Paradesha Gamana, or there is it in the Prasatantra or Paratantrata, or whether it has to be analyzed based on the Amsha Amsha Kalpana. Whereas Dosha Swabhava, that is nothing but the tendency to vitiate the dhatu, but the organs such as Kesha, Nakha, etc., they are not going to get afflicted by the dosha as such. Dear ANA community, that is what is being discussed in this particular video. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video active in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of Nidana learners so that we can make a huge movement out of this particular small message.